Welcome back to AM Northwest. It's an amazing new way to treat gum disease that's not only less painful on a patient, it also heals faster than traditional surgery. Here to tell us more, welcome back from Sleep Dentistry Defined Implant and Laser Center, Dr. Heath Lampee. Good to see you.
Thank you, Helen.
We've got a new name, Sleep Dentistry Defined Implant and Laser Center.
Well, it's not quite a new name. It's kind of a new tagline.
Tagline.
Maybe
okay.
a hashtag, perhaps.
Well, tell me about the laser and how important it is.
So we've been doing the laser for almost 2 years now,
Right.
but it's actually been around for over a decade. It's FDA approved for true regeneration of diseased gum tissues. So old school ways of treating gum disease are scraping, the scaling and root planing. Nobody really likes those. And when the gum disease was more...
Even just hearing it.
It's not the great. It's like nails on a chalkboard.
Yeah, I don't like that.
And then if the gum disease was advanced, you would actually have to do they would open a flap in the mouth, really scrape the roots, suture it, and all your roots would be exposed afterwards, leaving teeth very sensitive, prone to decay, and nobody would ever say they would want to do that procedure again.
Who are the patients that benefit most from this laser?
So the patients that benefit most from the laser are the ones with moderate to advanced gum disease. The hygienist is always doing those pocket measurements, 1s, 2s, 3s. You know, we all go through that. But when your pockets gets to 5, 6s, 7, 8s, 9, 10 or more, that's...
Oh, I've never heard that.
No, no. You are obviously a flosser.
Yeah.
So with those patients, gum disease is advanced, bleeding, bad breath, sometimes even their teeth are moving. We use a laser on them. And what it does, it can go into the pockets, kill the bacteria that are actually causing the disease. And here we have a pictorial of it. So that's a laser. It's a very thin fiber, about the width of a hair. It goes into the pocket and starts removing the diseased tissues.
Wow, that's wild.
It's killing bacteria. It's also opening the gum pocket, that 5 to 10 millimeter gum pocket, so that we can actually start getting the tartar off too.
Right.
So, and after that we do ultrasonic cleaning, like what a normal hygienist would do, and then we actually go in there afterwards, and there we are, just basically getting the barnacles off the tartar. Those are all bacterial deposits. And once all the tartar is off, we actually kind of seal up the base of the pocket, sterilize it, and then we seal it up, and the blood becomes a little sticky, and it releases these growth factors and seals it up very, very nicely. And this is a pictorial of the blood becoming sticky. It kind of looks like a Twizzler in a way.
Yeah, it does. Does this help with how someone feels and just improve their health overall? So
the big thing that we're starting to discover as a profession is the link between dental health and the health in the rest of the body. Patients with diabetes are more likely to have gum disease. Patients with heart disease are more likely to have gum disease. Patients with autoimmune disorders and rheumatoid arthritis are more likely to have gum disease. So there are studies being shown that if we can control the infections in the mouth, that means there are less bacteria that are getting into the rest of the body. And most of these diseases are chronic inflammatory disorders. And so if we can reduce inflammation in the mouth, kill these bacteria, the rest of you is going to be better. You can manage your blood sugars better. You have less of a risk of having your first heart attack. Your autoimmune disorders may get better as well. It's fascinating to see what leaps and bounds we're making in dentistry to actually be becoming real doctors in a way, you know? I know there's always that joke, you know, about dentists, but we're finding that our treatments now are helping, and the laser is the best way to do it. And not that many practitioners have it yet, because it takes time for people to change the way they were learned and taught in school.
And what is the downtime?
So patients will be sore for probably 1 to 3 days afterwards. They're on a very, very soft diet for the first 2 weeks. And then they can't actually brush their teeth for the first 10 to 14 days, because we don't want to mess up with the seal. But I clean them really, really well during the procedure. So it's 1 to 2 weeks afterwards where it's, you know, you have to have a special diet and stay away from the teeth, but long term, it's going to change your life.
Absolutely. Well, and so folks, if you'd like to find out more about Sleep Dentistry Defined Implant and Laser Center, you can give them a call at 503-646-2273. Thank you so much.
Thank you, Helen.